Good morning, everyone. Lovely to have you all with us. We're just going to give it a few minutes till a few more people dial in. So give it a few seconds or minutes, I should say. Morning for those just joining. We're just going to give it a few minutes for a couple of others to join. We have over 160 registrations, so probably give it to 100 and then kick off. All right, we might kick off. Good morning, everyone. I hope that your Monday morning has got off to a good start and that you had a lovely weekend. Welcome to Mental Health Coordinating Council's member briefing on workforce development in practice. My name is Evelini Tadros and I'm the Chief Executive Officer for Mental Health Coordinating Council, and I'll be your host for today's webinar. Before we begin, in the spirit of reconciliation, I acknowledge the traditional custodians of the land on which we are dialing in from this morning. Today, I'm on the land of the Cabral clan of the Darug Nation, and I pay my respects to their elders, for they hold the memories, the culture and dreams of the Aboriginal and Torres Strait Islander people. I recognise and respect their enduring heritage and deep connection to land and waterways. I recognise those with lived and living experience and mental health challenges and their advocates and allies. Your experiences continue to inform the work we do. I also extend my empathy and understanding to those who remain private and silent about their mental health challenges and or experiences. A couple of housekeeping items to go through. This meeting is being recorded and will be shared with attendees after the event. The PowerPoint slides will be distributed post-event with speaker approval. That is always the first question that is asked. I can assure you, with the speaker's approval, we will provide the slides. A reminder, if you have any questions, please drop them in the Q&A box and we'll get to answering them once we reach the Q&A session. Finally, once this meeting ends, you'll also receive a survey on the webinar. We welcome your feedback, suggestions and comments to help improve the webinar series. Thank you for joining us today, and we're looking forward to today's session on workforce development in practice. Before we begin, I'll provide a brief background to today's topic as the community mental health sector continues to grow and evolve. Traineeships offer a practical pathway to build workforce capability and support future workforce needs. Today, we will explore peer work training pathways in New South Wales, the benefits and requirements of traineeships and the practical supports available to organisations, supervisors and learners. You'll be hearing from our sector and training experts about how traineeships can be implemented effectively within community mental health settings to attract and retain staff and grow the peer workforce. I'm delighted now to introduce our speakers and our panellists. Jessica Radican is the Principal Statewide Peer Lived Experience Workforce Officer, Mental Health Branch, New South Wales Ministry of Health. Susan Scowcroft is the Executive Director for New South Wales Community Services and Health Industry Training Advisory Body. Leon Esho is the Training Advisor, Training Services with the New South Wales Department of Education. And I extend my thanks and gratitude to Michelle Humans, who'll be joining our panel later on and is our MHCC Learning and Development Manager, who also curated today's webinar. So thanks, Michelle. So it's my delight to welcome our first speaker, and without further ado, Jessica is the Principal Statewide Peer Lived Experience Workforce Officer, which is a lived experience designated role appointed to the New South Wales Ministry of Health. Mental Health Branch. In her role, Jessica provides leadership, support and direction for the development and growth of the New South Wales Health peer workforce. Jessica is the contract manager for the New South Wales Peer Workforce Training Program, increasing access to free training for peer workers in qualifications such as the Certificate for Mental Health Peer Workforce. Over to you, Jessica.
Thank you very much, Evelini. Just going to share my screen. Yeah, that should be showing up now.
Yep, thanks.
Hello, everyone. Lovely to meet you all. My name is Jess, and I'm the Principal Statewide Peer Workforce Officer at the Mental Health Branch. I would like to start today by acknowledging the traditional custodians of the lands that we're joining from today. For me, that is the Wallumattagal people of the Eora Nation, and I pay my respects to elders past and present. I'd also like to recognise people with a lived and living experience of mental distress, as well as those that are impacted by suicide, including families, carers and kinship groups. We recognise the preferences, wishes, needs and aspirations of people with lived experience that are at the heart of the work that we do. And I also want to recognise lived experience advocates who paved the way for the New South Wales Health Peer Workforce and the community managed peer workforce, and the voices and expertise and experiences of peer workers who continue to shape the future of healthcare. And just acknowledging today, we're here talking about peer work and really looking forward to having this conversation with you. So today I'm really going to be setting the scene before I pass over to two of our fantastic experts who are going to be talking about traineeship programs. So today I'm going to be talking a little bit about the development and professionalisation of the peer workforce over the last 30 years. I'm going to be speaking to the recent publication of Elevating Lived Experience Expertise, which is the New South Wales Health Peer Workforce Framework. I'll outline some of the access pathways that we have in New South Wales to fund the Certificate for Mental Health Peer Work. And then we'll talk a little bit about who's currently accessing the Certificate for and how they're going about accessing that pathway. So before I start, I want to acknowledge that while we're talking about peer work, and we often talk about peer work as an emerging discipline, peer work has actually been around for more than 30 years. And I just want to acknowledge up front that that's 30 years of expertise, that's 30 years of advocacy, that's 30 years of knowledge, skills and experience that has built this discipline from the ground up, that has really been the driving force behind the scope of practice that has led to qualifications such as the Certificate for. And while most of what we'll be talking about today is really around how we develop and support the future of the Certificate for, I do want to acknowledge those who've been a part of that process in really embedding the peer workforce through the last 30 years of advocacy, both from the peer workforce, but also from our allies who continue to advocate alongside us. The peer workforce, particularly in the last 10 years, has seen some significant change. And I think when we're talking about traineeships today, it's really important for us to think about the context as to how the peer workforce has changed, developed, grown and professionalised within the last 10 years in particular. So I've pulled out some of these significant drivers of workforce development just to give you a bit of, context to the landscape that our trainees are going to be working within at the moment. So 10 years ago, or 11 now, in 2015, the Certificate for Mental Health Peer Work was approved by the Australian Skills Quality Authority. And this was the first nationally recognised qualification for peer work and a significant milestone for our discipline, really cementing us with the skills, the knowledge and the competencies to really be able to back and say that peer work is a pillar of New South Wales health and community organisations in how we deliver mental health care across New South Wales and across the country. And the Certificate for has been really pivotal in being able to uplift peer work as a discipline and be able to really cement and elevate lived experience expertise. Alongside qualification, we have seen significant growth of the peer workforce over the last, in particular, 10 years. We recently published in Elevating Lived Experience Expertise that in New South Wales Health, we've seen 244.9% growth since 2017. That's really significant. And having worked in community managed organisations before, I know that growth is actually quite similar in those spaces too. So it's really exciting to see that peer work is continuing to grow. And I think there's an opportunity for us today to look at how traineeships can support that growth. We've seen an increase in funding and investment for peer work, and that includes areas such as reform So we've seen reform investment that's really supported and amplified peer work opportunities. But we've also seen organisations recognise the value of peer work and continue to invest in peer work positions, uplifting their FTE. And we've certainly seen this in community managed organisations as well as in New South Wales Health. We've seen state and national plans and strategies continue to name peer work as part of actions and really embed peer work actions as a core component of how we continue to transform mental health and suicide prevention in particular. And this is really exciting because that has translated to national, state and organisational frameworks. And certainly I've seen across the state many of our frameworks really stating quite clearly the importance of training pathways for peer work as an important component of how we develop the workforce. We've seen peer work translating into organisational policies and procedures as a core component of the workforce, as well as into models of care. And really excitingly, we're seeing peer-led models of care. And this is, not a new thing. We know peer-led models of care have been around for a while, but we're starting to see more and more peer-led models of care. Peer leadership is growing. I can actually see in the room, we've got quite a lot of our peer leaders from across the state, and certainly an area we're continuing to see grow. So career pathways are developing, which is why qualifications are just so important, and making sure that we've got that great support, particularly during those first 12 months within a career. Research and evaluation continues to tell us that peer work works. We know that peer work is effective for people who are accessing care in New South Wales. We know that peer work is effective for services that are employing peer workers, and we know that it does influence the culture of organisations. And research and evaluation is continuing to tell us that peer work is effective. And this year, which is really exciting, we now have a national association. So the Australian Association of Peer Workers has now been established, and it is very exciting to see where that will take us into the future. So there has been a huge amount of work to develop the peer workforce. And I think it's really important when we're thinking about traineeships and about the future, that we have an idea of the context of where peer work has been, but also we start to look at where we can go to develop a pipeline to support peer workers into the future. Our goal in New South Wales is to develop a thriving, well-supported and empowered peer workforce that provides lived experience expertise to enhance and support people accessing care in New South Wales. And I want to acknowledge that at the heart of all of this progress, development and growth and professionalisation are peer workers, people with lived experience, but also our allies who stand behind us and strengthen our voice. They continue to educate and advocate for peer work as a foundational pillar of the New South Wales workforce. So we spoke about frameworks. So one of those key frameworks and documents that New South Wales Health has developed recently is Elevating Lived Experience Expertise, a framework for the New South Wales mental health and suicide prevention peer lived experience workforce. So we published this document at the end of last year, and this document provides guidance for the New South Wales Health peer workforce to support, develop and grow the workforce. It does provide guidance around the Certificate 4, and really importantly for New South Wales Health, it does state that we are moving towards a Certificate 4 as the minimum training for peer workers to work safely and effectively with consumers and carers of New South Wales Health services. I know that community managed organisations do have similar frameworks that might articulate particular trainings that they put their peer workers through. Certainly for us, the Certificate 4 is sort of the direction that we are moving, but acknowledging there are also other trainings that might supplement the learning of peer workers. At the moment across the state, we have 4 funding pathways that really aim to increase access to the Certificate 4 in peer work. The first is the scholarship program. I think this is probably the program that most people would be aware of. So this is a program that the New South Wales Ministry of Health has funded since 2015, so when the Cert 4 came online, and really aims to support peer workers to access subsidised training pathways to be able to be qualified against the Certificate 4 and to build the skills and competencies to work within their peer work scope of practice. This is a program that we're really proud of, To date, I think when we published the framework, we said that we'd invested around 1.5 million. With recent investment, I know that that's now above 1.5, and really demonstrates the, I guess, commitment of New South Wales Health to ensuring that peer workers have access to minimum qualifications to support them in their career and to cement peer work as a discipline. Alongside the scholarship program, we do have the Smart and Skilled funding stream, and I will acknowledge that there are probably people in this room, including my colleagues on the panel, who can probably speak to the specifics of this with more authority. But very broadly, this is a New South Wales government initiative that subsidised training across identified workforces and qualifications. And peer work is one of those identified workforces. And the Smart and Skilled funding is provided to registered training organisations up to a particular cap and really aims to increase the workforce. So this is an opportunity available to peer workers to access fee support. In addition, we've got the traineeship pathway, which is what we're here to discuss today, and really excitingly provides the opportunity for peer workers to access fee-free training along with on-the-job support. And then there's the fourth stream, which is pay to study. And there are peer workers who are either paying outright or their organisations are paying to study, sometimes alongside some of these other pathways as well. There are three ways at the moment that we're seeing people being able to access the certificate for. So the first is as a student. And I say that meaning there are often peer workers who might be considering a career in peer work. They may not be employed. They might be studying the certificate for and come across our services because they're looking for a student placement. So that's one really critical pathway to accessing the certificate for. And this is really important around how we consider student placements in our organisations. The second pathway is around traineeships. So traineeships really provide that opportunity and rigour for skills, training and on-the-job support to develop competencies as a peer worker. Also a great opportunity if you're new to peer work in your first few months, if you've got a peer worker that's starting in your organisation, to be able to give them a really well-rounded support within those first sort of year to get both the on-the-job skills, but also access to the training, and to do that in a way that's really well supported. So this is a really great opportunity to be able to plan for traineeships. And then lastly, we've got peer workers who are already employed within organisations who are looking to acquire the skills, knowledge and competencies to work to their scope of practice. And by doing so, they enrol in the certificate for. They might be completing their placement as part of their job, or they might do that external to their organisation. It might be a requirement of their position description, which is the case for many roles in New South Wales Health. And if they have work experience or existing qualifications, which most of our peer workers do, they may be able to apply for a credit transfer or recognition of prior learning pathways. I will acknowledge that to date, I would say the majority of our focus has really been on qualifying our peer workers who are already employed within organisations. And I think this has really been for the last 10 years where we focused, particularly having an existing workforce. When the certificate for came online, we wanted to make sure that our workforce had the opportunity to access that qualification. Where the opportunity is for us today and moving forward is to look at how we attract, develop and strengthen the workforce pipeline for peer workers, looking at the student placement pathway and traineeship pathway, because this is really where we're going to create that career progression, all the way from thinking about and contemplating a career in peer work to how we embed and really structure a traineeship program to support someone within that first 12 months of their role, all the way through to how we actually support someone through their career. So this is really where the focus of the conversation will be today. And I guess the opportunity for us across both New South Wales Health and community managed organisations into the future. And alongside that pipeline, there's also some really important, I guess, pieces at the state level and national level that are happening around qualification and professionalisation. So in addition to the certificate for, we do also have nationally accredited units of study, which is really around how we are supporting specialisations of peer work. And we're starting to see these nationally accredited units emerging. An example of that is the Peer Navigator Unit of Competency, as well as the Peer Leader skill set. So there are some great examples of where there's some expanded learning for those that are working in specializations. We're starting to see adaptations of the Certificate 4. So for example, for the AOD peer workforce, there's a current trial with MHCC to really expand that scope to ensure that the AOD peer workforce can access the Cert 4. There is a current review of the Certificate 4 at the national level by Human Ability to make sure that it's fit for purpose for now, but also for the next decade, so that what we are training our peer workers to do is aligned to the scope of practice of what they're actually doing in practice now. And we're also looking to the Australian Association of Peer Workers, really making sure that we're aligning our expectations of training to the directions that might be set in the next few years by the association. I've given you a lot of information and context as to where we are with peer work, with training and development, and with qualifications. And I just want to acknowledge the significant amount of work with peer workers that has led to qualifications, that has really built our professionalisation and has really cemented us as a discipline in mental health, suicide prevention, AOD, and in many other sectors. And I'm really looking forward to hearing from the other panelists today about how we can support peer workers within that traineeship program to really support their career development and continue to grow the peer workforce into the future. Thank you very much.
Thank you so much, Jessica. Really appreciate your presentation. It's just so clear and succinct. I think sometimes it can be quite challenging to understand the pathways and the options. There is myriad of information out there, but they're not always accessible. So you presented it in a very clear way. So thank you very much for sharing your knowledge with us. I would now like to introduce our second speaker, Susan Scowcroft. He has been the Executive Director of the New South Wales Community Services and Health Industry Training Advisory Body, also known as ITAB, let's try that, and has been involved for over 25 years with ITAB. Susan has managed and facilitated over 20 cross-sector industry projects and has overseen many more, developing workshops, forums and online resources and industry networks to inform and resources on effective and competent workforce to meet the needs of our community. So it's a delight to have you with us, Susan. Thank you so much for joining us. Over to you.
Thank you very much. Let's see if we can get this one working already.
Yeah.
We're going?
Just put it into presenter mode and then you're good to go.
Yep. Oh.
That's showing a background picture of a lovely sunny day.
I know. With a lovely family, aren't I lucky?
Oh, beautiful.
Okay, let's try again. Sorry. There we go. Okay. And just won't let me present it. Here we go. Here we go. She says confidently.
Got this.
Let me present it. No. Right, here we go. Look at this. Yay! Anybody think I'd never done it before?
Well done.
Thanks.
Thanks.
Sorry, everybody. Monday morning, I'm going to blame Monday morning. I too would like to recognise our First Nations people and also people joining us with lived experience today. I'm really excited to be here to talk about and open a discussion around a traineeship pathway for our mental health peer workforce. The New South Wales Community Services and Health ITAB is an autonomous not-for-profit industry-based association. We have a board, a tripartite board of peaks, which MHCC is one of, employers and union representatives. We work across all of the community services and all of the health industry sectors. And we work, so you can imagine that's really hundreds of different sectors and hundreds of different job roles. We provide an independent voice working with our stakeholders across all of those areas, providing advice to the New South Wales Department of Education and Training through Training Services New South Wales, but also through a lot of the other units within the department, early childhood education and care and others. Providing strong advocacy for training and for appropriate training and skills needs for the workforce, for our workforce at all of those different levels. Predominantly, we work across the accredited training, which sit in our training packages, the community services training package and the health training package. They, between them, hold over 100 qualifications across a myriad of industry sectors. One of our key roles is to provide advice to the department about traineeship pathways around the qualifications that industry themselves has seen as suitable for a traineeship pathway, and the Cert 4 mental health peer work is certainly one of those. So we're very, very keen and very thrilled to be working with all of you to try and promote this as an opportunity for building a career in the sector. What is a traineeship? It's an employment-based program. So as an employer, you are employing your trainee. That trainee works in their paid role while simultaneously completing, with the support of a registered training organisation, the qualification, in this case, the Cert 4 mental health peer worker qual. You must be employing them in a role that is relevant to the qualification. Too often we see with people who don't quite understand the way traineeships work that an employer will employ the trainee in a role that is not actually supporting them to experience the full scope of the qualification that they are undertaking. It's really important that the trainee understands and is working in the job role. Now, obviously, as a trainee, not yet skilled, not yet competent, hasn't yet attained the qualification. So this is where buddying and supervision and mentorship becomes really important in the traineeship environment. For individuals, it's the possibility of launching a career. So you're working not only studying, because that's just one very small, it's obviously critical, but it's a small part of what you're doing. You're actually turning up to work every day and you are shadowing, you're buddying, you're working to the degree that you're competent to be able to do that in the job role. For an employer, it's the ability to be able to identify people who really are a good fit with your organisation and who somebody who's really keen to follow this as a career opportunity. And I guess we've all got little sort of short, smart, earn while you learn is the little kind of tag for a traineeship. And for an employer, it's really critical in the sense that you're able to grow your own. You're able to bring somebody in very early in their career progression, and with your induction, with your work, with your experienced workforce, you're able to ensure that the new workers coming in are really a very good fit for your organisation culturally, for your clients, and I guess building success then for the individual as a very valued part of your workforce. So what does a competent workforce look like, and where does the trainee fit into that? We all know that in obtaining a qualification, you're not actually, when you come out with your qualification, it's not suggesting that your expertise has been reached. Rather, the qualifications that sit in training packages identify what the sector sees as the minimum to be a competent worker when you're starting out. So that Cert 4 is our benchmark, if you like, for the knowledge and skills required to be a capable worker. So when you start out, you've got a little bit of time in the job, in your job experience, in your role, and you've also only spent a wee bit of time with your organisation. As that grows, which is the yellow arrow, we've got the training and experience that comes with more time in your organisation. As that goes through, and particularly if you're then employed as a trainee, that is partnered with a registered training organisation, and they are doing the formal part of the knowledge and skill development, while the trainee, with the support of the experienced workers, is achieving competency. Once the qualification benchmarks have been met, then the registered training organisation is able to provide the individual with the qualification, and the employer continues their relationship with the employee, going on, building and extending on that knowledge and skills so that you become a really proficient, experienced worker who we hope will then be able to repay that by supporting, as an experienced worker, it's supporting another trainee or other trainees who come into the workforce. Part of that competent workforce is, and it was Jess mentioned it a wee bit, which was we have accredited and non-accredited training. The qualifications that sit in the training package are accredited qualifications and can only be delivered by a registered training organisation. We know that non-accredited training can be very valuable in developing a competent workforce. MHCC has been working really hard in developing units of competency that also can be accredited, that sit equally with anything that's sitting in the training package. The peer navigation unit of competency is an example of that. But at the same time, as a peak body, MHCC may be developing non-accredited training to skill up our workforce where gaps may have been identified, where the training package has perhaps not moved on as quickly as the sector has moved on. And while we're waiting for the accredited training to pick up on that, non-accredited training to build those skills and that knowledge in the workforce is very valuable. But the benchmark of recognition across the accredited certificate for is really important. It's nationally recognised. Once a candidate has that qualification, they can go anywhere in Australia and be recognised by any employer as holding that knowledge and skills. And New Zealand also, in our world, recognises Australian qualifications from the training package. Okay, so what's involved? We have mostly, we have traineeship pathways in New South Wales that are new entrant. That means that somebody either has to be a new entrant into your employment or can have been with you employed but for less than 3 months. So they're still considered a new entrant into the job role. So from an employer's point of view, it's really, really important that you have identified experienced workers who are able to provide effective supervision and support for this new entrant while they are understanding the job role, understanding their scope of practice. That comes through your thorough induction period. That will be probably exactly the same as if you're taking somebody who's not a trainee, who's not doing the qualification concurrently with their employment. Working in that buddying role or that supervision role is really critical. All the research around traineeships and apprenticeships show that success from achievement of the qualification and success while working comes from the quality supervision and the quality support provided in the workplace for the trainee. It's also critical that the supervisor, the nominated supervisor, and somebody in the organisation retains a very strong relationship with the registered training organisation. You guys are really lucky. You've got MHCC as an enterprise, as a sector-specific RTO who really understands that. It's really important that those lines of communication between the RTO, between the supervisor, between employer and the trainee are really strong and really open, so that the greatest success can be attained. That there is administration and coordination involved in it, and I think Leon will be talking to you a wee bit more about that. And the trainee also, from a traineeship employment point of view, is must have some off-the-job training opportunities. The employer continues to pay them, but that may be, if you don't have perhaps in the job role the scope that the qualification requires, it may mean that you that the trainee spends some time with another organisation, but it may also mean that they spend time in a different area of the organisation. So their scope, their learning, their practice is actually enhanced to meet the full scope of the certificate for. In New South Wales, and for those of you who have provide services across different states and territories, all states and territories have different requirements around traineeship and apprenticeship pathways. In New South Wales, our traineeship pathway is actually supported by an act, a legislative act. So that sets out and defines how traineeships are established, what must be done by an employer of a trainee and what's expected of the traineeship. So it's really important to know that it's actually got the rigour of a regulation behind it. Within the Act, the regulations sit, and that's kind of how the Department of Education makes sure the Act is well supported, and it details all the operational procedures that go along with employing a trainee. Leon will also talk to you a wee bit more about that, because that's his area of expertise. And sitting then behind that is what are called the New South Wales Commissioner Information Bulletin, or CIBs. These are available on the department's websites for everybody to see, and they actually ensure that the employment and training for trainees is safe, current, and meets our industry sector's needs. They outline the approved traineeships and the training frameworks, the industrial arrangements, the job descriptions, and any licensing requirements that go alongside the traineeship or the apprenticeship. And they define what we call the vocational training organisations, and the vocational training organisations massage out a bit more detail in that. So, for example, from an ITAB's role, we also provide advice around appropriate school-based traineeship requirements. Well, obviously the Cert 4 in peer work is not a school-based traineeship, but when you go into the CIBs, you will see the vocational training organisations vocational training orders, and you'll be able to see which pathways are available through school-based, for example, and the qualifications that sit behind them. One of the other things that I think I'll just mention quickly is very often when you hear apprenticeships is being used generically to mean apprenticeships and traineeships. It's a bit of a muddle for our sectors because we don't have apprenticeships, we have only traineeships in our sector. To make it worse, sometimes when they talk about apprenticeships, they're not talking about traineeships at all. So apprenticeships tend to be the earn while you learn, but for the trades environment broadly. And our traineeships are the non-trade pathways for earning while you learn. So that's pretty much the difference. So the essential supports from an organisation's point of view, the positive workplace environment, and making sure that the trainee has relevant learning experiences. Almost 100% of trainees who are surveyed having finished a traineeship will put that as the top reason why they finished. The experienced and skilled supervisors are really critical. The Training Services New South Wales provides supervision workshops. If you can identify people who, went too quickly. If you identify people in your workplace that you feel might need that extra experience with coaching and feedback skills. and an open and clear structured learning program. A model that shows how a trainee can move from being a dependent for supervision through the different sequence, if you like, of the training within the qualification and the registered training organisation's delivery of those sequences, building up to where the trainee becomes independent and successfully completes the traineeship. And that is about how you then can show that a trainee with a buddy or with 100% supervision, as they grow in their competence and their capabilities, that can become a little bit less parrot on the shoulder, if you like, of supervision. So that's about it from me, and hopefully we can work together really closely to create really successful traineeship models across the peer workforce.
Thank you so much, Susan. It is such a complex environment, and again, you presented in a way that simplifies it for us. So thank you so much for sharing your extensive expertise with us. It's great to have you with us.
Thank you.
I'd like to now introduce our final speaker. Leon is a training advisor with Training Services Department of Education, based in Western Sydney and Blue Mountains Regional Office. He supports apprentices, trainees and employers by providing guidance and ensuring necessary assistance throughout their training journey. And I will ask Leon to pop his camera on and join us. Thank you so much, Leon.
Thank you so much. Just give me 1 second. Alrighty. All right. Thanks everyone for joining. Really appreciate you guys tuning in. Before I continue, I just would like to acknowledge the traditional custodians of the land. I pay my respect to elders past, present, and emerging, and extend that respect to any Aboriginal and Torres Strait Islander people here joining us today. Okay. So, I'm from Training Services, Department of Education. I will go through essentially what we do and how we support you guys, both organizations, employers, and also learners in successfully completing a traineeship. I will also go through the ins and outs on the whole process and what that looks like. And at the end, there is some resources that you guys can access. I believe these slides will be shared to you guys at the end. So let's get started. So, what does Training Services do? So, we administer apprenticeship and traineeship contracts. We also are essentially the regulators of the arrangements. We also monitor employers, learners, and training providers. So, me being a training advisor, I am pretty much on the ground. I predominantly look after the inner west of Sydney. There are many training advisors located across New South Wales. Depending on where you are located, we do both proactive support or reactive support. Okay. We also manage training contract providers, training provider contracts, sorry. And we are also responsible for government subsidized training under the Smart and Skilled. Now, we training advisors are also trained mediators and conciliators. So if there's any additional support that you guys need, preferably your first point of contact would be a training advisor, and we would actually come out and meet face to face. Or you could just pick up the phone or send us an email, whatever works for you guys there. Okay. Traineeships, this is what we'll mainly be talking about today. So, traineeships combine on-the-job training with an employer and formal training with a registered training organization. I believe Susan touched on this just previously, but essentially, and I will go through this in the training plan, it's important that when you undertake a training, what they're learning and what they're doing is the same as what they're doing with the formal training components. Okay, so us training services, we've seen some really weird arrangements in from time to time. We've had people, doing a traineeship in just say a specific qualification, but they're completely doing something different on the job, which is a big no-no. Okay. The term of a traineeship is normally between 1 to 3 years, covering a wide range of industries, but we also um, we approve training contracts under the vocational training order, okay? Published in sector-specific commissioner information bulletins, and we also currently publish CIBs and VTOs are found on the New South Wales government website. Now, the Apprenticeship and Traineeship Act 2001 is what we operate under. So it is a legislative framework for delivery of apprenticeships and traineeships in New South Wales. Okay. This supports the Act and further defines some of the requirements and conditions for apprenticeships and traineeships under the Act. There. Now, the whole run through on how to get started, right? So just say you have somebody that wants to, undertake a traineeship with you guys or as an organization, or you're thinking about, starting that conversation with an organization. How do I get started? So first, there is an employer and learner contract, okay, that needs to be properly defined and signed. Once that has happened, there are field agents called apprenticeship providers. Okay, in this case, for example, we use Busy at Work. They're an organization. What they do is they actually head out to site, meet you face to face with you, the learner, and they do all the contract signing, get your information, and they also communicate with the registered training organization. Okay. Once that happens, Busy at Work will then lodge the contract to training services to me, which then we will approve. Okay. Once we have approved the contract, you will receive an email from the Department of Education saying that the contract has been established. Okay. So both the employer and the learner get a copy of that letter. Now, training contract and training plan proposal. What are these? Okay. So a training contract are legally binding agreements between the employer and learner. Okay, this outlines the learner and employer details, proposed apprenticeship, traineeship details, conditions of the apprenticeship and traineeship. Okay, now the training plan proposal is signed by the employer, learner, and the registered training organization. This confirms that the registered training organization agrees to deliver the formal training. Okay, and it outlines the initial information about the formal training arrangements. Okay. The employer must complete a training contract within 28 days of the training commencing employment. Okay. So you have somebody that starts with you guys, it's best to, reach out to Busy at Work and organize a time for them to come out and get that sign up completed. A full training plan will be developed in conjunction with the registered training organization and employer within 12 weeks of the approval of the training contract. Okay. And I know I've said training plan a few times, and I've actually got a few slides which will detail what that looks like. So we will touch on that in a minute. Now, varying a training contract. So when you enter a contract with a learner, or if you, start a traineeship with an organization, you have a set time of finishing that contract. Now, in saying that, sometimes life happens. You might have to go overseas for an extended period of time. You might be, other responsibilities pop up and you're not able to meet your obligations. We can always vary the contract, okay? We want to support you guys and we want to have, successful completions. So, three things. We can extend the contract, okay? So just say you need a little bit more time for your trainee, or the trainee needs to complete the formal training. We can always, grant more time, okay? It's just a matter of just reaching out to us and just filling out a form, and we obviously can assist you guys with that. That is the extensions, okay? We can also pause the arrangement, okay? So what does pause the arrangement mean? So just say they're facing challenges, that is affecting their efforts to complete the traineeship. We can pause the arrangement. So that doesn't necessarily mean they stop working with the organization. It just means that they're not obligated to, undertake the formal training obligations on their end. Okay, so we can do that for a set period of time, and when things become back to normal, we can then kick off where we started there. Okay, and just say you have a person that tries, doesn't think the industry is for them. We then can obviously do a cancellation, which closes off the record. Okay, it's just it's important to let us know if you do need these changes as soon as possible to avoid the risk of the contract going into an expired status. Okay. Look, sometimes it happens. Sometimes, there's a lot of moving parts in organizations, and I understand things get really busy. It's just picking up the phone and reaching out to us. We obviously want to work with you guys and support whatever arrangements that, need to be done. Okay. Now, so just something to reflect on for you guys is just defining the expectations of my learner. Okay, so your learner must make every effort to gain skills and industry knowledge they need to successfully complete their traineeship. So just think about it. What are the support systems I have in place to ensure that, my trainee or my learner, has, if you're providing, really good support systems in the workplace, that's going to reduce cancellations. Training services, our main goal is to obviously, provide that ongoing support, like I said before. But it is really important to obviously keep us in the loop on what's going on with your learner or with the organization. Okay. Furthermore, onto this, so mental health and well-being. Okay, so 1 in 5 people will experience mental health challenges each year in every workplace and has a role to play. It is more likely that a learner will complete their training if you prioritize mental health and well-being at work. So here's a list of some negative risk factors and positive protective factors there. Benefits of an benefits of inclusion at work. Okay, so this is from the Diversity Council of Australia. So inclusion is good for performance, right? So inclusion workplace index consistently shows a strong link between inclusion at work and team performance. So, for example, an inclusive teams are 9.5 times more likely to be innovative than non-inclusive teams, 4 times more likely to provide excellent customer service, 8.5 times more likely to work effectively together, and 2.5 times more likely to be willing to work extra hard to help their team succeed. Now, so training services, what support systems do we provide to underrepresented or learners who face hardship? Okay, so 3 main things. Aboriginal and Torres Strait Islander learners. So if you say undertake somebody who is Aboriginal or Torres Strait Islander, we will get notified of that, and we will do a proactive reach out to you guys just to go over some of the support systems there. The biggest one is the Barangarra Mentoring Program. So it is initially a skilling for employment. Oh, sorry, it's a mentoring ship that it's not just limited to work, but it's also their personal life as well there. Okay. And then, yeah, further down is the Barangarra Skilling for Employment Initiative. Learners with disabilities. Employment Assistance Fund, Employment Assistance Fund, or Job Access, tutorial, interpreter, or mentor services is what we can provide with. And apprenticeship providers, so Busy at Work is the guys I touched on before, they also have a mentoring program. When they do come out and speak to you guys and get the contract ready for us, they will go over their mentoring programs, okay? And that's free of charge. That doesn't cost anything, and that's there for the learner to utilize. Now, this is the probably the most important part I just want to talk about because it can get a little bit confusing. So hopefully me explaining this will kind of break it down in simpler terms. So this is the training plan. So the training plan essentially is a legal document that the registered training organization provides to you guys, both employer and learner, outlining all the units of competency that they'll be undertaking throughout their traineeship. Okay. This is this is just an example, but from 12 weeks of the approval dates, you will receive this fully populated with all the units that they're going to be studying. As you can see, you've got a unit start date and end date. That kind of gives you an idea on, the progression throughout their traineeship, and then also the assessment details at the end. If you have a look, 2 signatures are required to actually complete a unit. 1 from the registered training organization, and 2 from the employer or the supervisor themselves. Okay, so it is a working document. Okay, it's very important that you guys have a copy on hand, so it can kind of help you understand, all right, this is what they're doing next. I need to make sure that what they're doing in the workplace also reflects to what they're doing in the training plan there. Okay. Now, competency and completion. So, collecting evidence from your learners' skills and knowledge and compare it to a set of industry standards. This could be written assessments and assignments, theory and simulated training environments, observations in your workplace. Industry competencies from the employer is that they can use the correct tools or materials, perform the task to industry standards, consistently complete the task in a timely manner, confident interactions with employees and clients. Now, obviously, in the traineeship arrangements, it is a little bit different. So it is very important that once you receive the training plan, have a chat or have a sit down with the learner and have a plan in terms of what we're going to be doing moving forward. Okay. Furthermore to that, under the policies and procedures from the Department of Education, a trainee is entitled to a minimum 3 hours per week of paid study time. Okay. Now, in terms of how that's broken up, that's completely up to you guys. Okay. It could be 1 hour a day, it could be 3 hours on a Monday. It really depends, but it's a mandatory requirement of 3 hours per week. Okay. Now, just say you've completed through all the units of competencies. You guys or the organization will receive this. This is the part 5 of the training plan. Okay. So this pretty much needs your endorsement saying that once they've completed all their units, you are happy to endorse their competency. Okay. Once they actually receive this, okay, they will actually get issued 2 certificates. One from the registered training organization and a certificate of proficiency from the Department of Education. I know I'm kind of breezing over this a little bit quick, but again,
Leon, we actually do need to move on as well. So can I give you
yes,
one more
no
minute
problem.
to wrap up, please?
Yep. Okay. Resources and support. Look, I'll just touch on the most important thing here is that the department actually provides supervisor workshops free of charge. So just say you have an influx of trainees starting with you guys. We host an in-person free supervisor workshop that details everything that I'm talking about in more finer detail there. So there's various training services offices across New South Wales. Once you get the slides, you can kind of navigate on where you're located and see, the closest training services office is there. And there's just a link tree at the end there. So you're more than welcome to scan. It has a drop down of all the guides, resources, forms. And I think that's it from me.
Well done, Leon. You have captured quite a lot of information in a very short span of time. So thank you so much. I think what's evidence today is, number one, the amount of questions and participation engagement goes to show that this is a really important topic that people want to hear about and engage with more. So thank you very much, Leon. If I can ask all our speakers to put their cameras on and rejoin. We can maybe take that screen off, Vanessa, just to maximise the speakers. So if I can invite Jessica Radican, Susan Scowcroft, and thanks, Leon, for staying on. I'd also like to invite Michelle Hummers, who is our wonderful Learning and Development Manager at MHCC. Michelle leads the MHCC Training and Development Initiatives. She oversees the delivery of accredited and non-accredited training programs and works closely with the sector to support workforce capabilities and professional development across the community managed mental health services, and has done an incredible job in answering all as many questions live. we will make sure that those questions that have already been answered provided with the slides post the event, and then whatever questions we're unable to answer live now, we'll also try and get to answering them. But again, a huge demonstration that there's lots of inquiries and lots of interest in this. So the team have done a wonderful job in asking people to look at the Q&A section and thumb up the questions that they want prioritised, mainly to assist me in working out from the myriad of questions that are there. I think we've got 20 questions, which ones we should bring to the live group. So bear with me while I do that. The first question here that we're going to answer is how much of the certificate for mental health peer work, there's a lot of questions about the certificate rather than the traineeship, so bear with us. How much of the certificate has been developed and continues to be updated and refreshed by those with lived experience? I feel like I learned so much about peer work, and being a peer worker looks and feels like after completing the intentional peer support certification. So I know that I'm very pleased as MHCC. Last year we celebrated 10 years of having developed that course 10 years ago, and we put that on scope nationally along with other partners, and it was developed by people with lived experience, and peer workers, and all our trainers are people, are peer workers. So they are also developing that course and the modules that are developed. But I might go to Michelle if you would like to answer anything there, and then happy to take anything from the floor.
Thanks, Evelini. Such an important question, so thank you for asking that. What I want to lead with is we understand that there are multiple pathways to peer work, and so we are, as MHCC, and similar to what Jess was saying, as part of New South Wales Health, really supportive of the Cert for mental health peer work as kind of a benchmark entry qualification. However, it's really important that in the peer work space, we also don't kind of get into a bit of a pitching almost different trainings against each other. So the Cert 4 and IPS are both incredibly valuable. I think they have a lot of similarities in what they aim to achieve and some key differences. So in terms of lived experience remaining at the centre, for us as an RTO, we continue to engage with industry and lived experience and recognise as well that there are often systemic barriers to people accessing formal learning. So we try to really consider that and hear from people who want to do some training to really incorporate that into our course design. But really just want to echo that it is so important that lived experience remains central, and certainly at MHCC we do practice that.
Thank you. Any other comments from anyone? Otherwise, we'll move to the next question. Susan's got a comment.
Could I just quickly add in there, Evelini, that it was mentioned earlier, I think, Jess, that Human Ability is currently reviewing the accredited Cert 4 that sits in the training package. And I guess I would just like to advocate with all of the people here, it's critical that when that comes to public consultation, your voices are really strongly heard in that review. It's the only way the qualification, and so many of the comments in the Q&A are about the qual, and this is the only way that we're going to make sure that the revised qualification is absolutely fit for purpose. It's diverse enough, flexible enough, but rigorous enough to actually meet the roles that the peer workforce inhabit. And that it really reflects that lived experience voice. And I think I can't speak too highly about that. And I'm really happy to work with MHCC to provide some professional development for those people who are experienced workers, to inform them about how they can actually go in and really provide informed feedback. Passion, passion, passion. Sorry.
Absolutely echoed. Thank you very much, Susan. Much appreciated. And we will, it has been challenging to get into review and support the review of Human Ability, but we'll make sure that when the document comes out for public consultation, that we push that out in our newsletter. So the team will put in the chats how you, if you're not already signed up to our newsletters, we'll show you how you can do that so that we can make sure that you're informed about the consultation document when it does come out. There is a question here that I'm going to try and interpret what I think is being asked. It is, How do we, as lived experience experts, move beyond supporting people individually into policy and decision making? So there's a little bit of a question of mental health peer work shouldn't just be about one-on-one support. It should also be about using your lived experience to inform policy and advocacy. I think that's the crux of the question. Forgive me, Anon, if I haven't captured that well. Any comments about that, Michelle, and then maybe Jessica?
Yeah, thanks, Evelini. Again, such a good question. I think the Cert 4 really aims to be, again, that benchmark qualification. So you're looking at entry-level peer worker roles who might be doing a range of different tasks. Often that is more direct consumer or carer work. So that's where the focus really tends to be. However, what we do, and again, certainly in the Cert 4 with Mental Health Coordinating Council, is that we also talk about continuous improvement, we talk about advocacy, we talk about all these other parts that are not only critical to entry-level roles, but could also be areas that you actually develop and progress into. Outside of the Cert 4, though, just like any other qualification, a qualification is not going to be all things to all people. That's just unrealistic. So what we've tried to do is then create some additional trainings, whether accredited or non-accredited, that can actually focus on things like policy, advocacy, leadership, particularly in non-peer work sort of dominated spaces as well. That can be challenging contexts. So peer navigation, different ways that you can actually continue that aren't always included in the Cert 4, which is about just getting that benchmark skills and knowledge. Jess, I don't know if you wanted to add to that.
And I think, Jess, you're living and breathing what this question is asking, that you're not doing direct work, but you're doing that policy advocacy, systemic review, whole of system change. So you're living and breathing it. Tell us your thoughts.
Absolutely. And having been, starting my career in peer work and having completed the certificate for, and then moving into other parts of the scope of practice now in policy, I think it's really important to acknowledge that peer work has such a depth of scope of practice. And the reality is that peer workers are working across a really varied range of roles, including that direct support with people and providing care in services, but also in education, in policy, in research, in quality improvement, in leadership. We want to see the training and the development that we structure around lived experience roles being really relevant to how we support the career development of peer workers into the future. And it really does start with making sure that we do have nationally accredited training and making sure that we're able to promote that for early career peer workers so that they have that as their discipline foundation to build on. And also being able to supplement it with that additional training. So things like intentional peer support, like the peer leadership skill set, and other trainings that are available so that peer workers have a really well-rounded training to support them to develop into the careers that they are looking to move into. And I know certainly from speaking with New South Wales Health peer workers, leadership, policy, education are all spaces that we're looking to really develop and grow.
Thanks, Jess. Leon, there's questions are coming directly to me as well. There's a question here about a person's been working in their role for over 12 months. Are they eligible for traineeship with their current employer?
They are, but it won't be a subsidized arrangement. So they can still do a traineeship arrangement, even if it's past, say, for example, 3 months where they're classified as a new entrant. It will be a fee-for-service arrangement. So essentially what that means is that either the learner or the employer will pay for the training.
Okay, and one more question with you. Do trainees get paid less, and are there employer incentives available? I assume that's if they're under a traineeship.
So there are employer incentives which are funded by the Commonwealth government, the federal government. So there is a commencement payment and a completion payment. In terms of traineeship pay, that has to be referred to the Fair Work Award. Now, obviously, it depends on the arrangement between the employer or the learner, but that award is the guideline for them undertaking that traineeship.
Okay. Susan, we're back to the questions around the review, and thank you to everyone who's supporting in the comments. The consultation document that Susan referred to is live, and there's some referrals to some links around that document. Susan, how will the Certificate 4 in Mental Health Peer Work Qualification Review affect traineeships, if at all?
Well, it won't. What happens is when the qualification is reviewed and endorsed, which is a process in itself. Won't go into it now. It goes on for as long as this does. Then that qualification becomes the qualification that registered training organisations add to their scope. So, and that qualification is then reviewed, I guess, by the industry to say, or by the sector to say, yes, we think that Cert 4 is suitable in New South Wales as a traineeship pathway, and it just updates the current one. So it won't affect, unless the sector says the endorsed one isn't suitable, in which case we won't advocate for it to be a traineeship pathway. But one would hope that throughout the process, the feedback is such and the listening is such that actually the qualification that's endorsed is a good fit and a good early entrant pathway into the role. As Michelle said, you also may have the opportunity, because there's a new world in the vocational kind of qualification reviews, and there may also be an opportunity to advocate for advanced skill sets, for example. So if you've got the Cert 4 as your benchmark, then there may be opportunities to look at some of the roles that are coming up in the Q&A and say we could actually have units of competency for that skill set. So once you've achieved your Cert 4, you could actually then undertake the skill sets for those new roles. I think that's where it becomes so important that experienced people who understand, A, where the job role's going, not just where it's been, but where it's actually going, will actually provide that feedback to human ability. From a New South Wales perspective, we as the independent ITAB try to work together with all of you guys to make sure that that information is well heard from a New South Wales perspective, because that feedback is national, and we've seen here that New South Wales is quite different in the traineeship, and we've got things on the Q&A from Victoria and from WA and all sorts of places. It's all different, guys.
Yes, it's very, yes.
So,
that's why I didn't answer that question.
Yeah.
There's a question here from Zoe. Are there currently any trainee, excuse me, or placement frameworks specifically for peer workers and the host organisations? How are organisations going to be incentivised to host placement students for trainees? Michelle, would you like to take that one? I can see you nodding, so I'm assuming you want to take this one.
Thanks, Evelini. Yes, so we recognise taking on placements, whether that's through someone that you've got employed, or particularly when that is not a person that is being employed with you, does take a considerable amount of resources. So we have been trying to explore perhaps putting together some practice examples in terms of where a traineeship model, and I think Susan and I have spoken about this, where a traineeship model has been implemented really effectively, to provide a little bit of an example that you can kind of see and maybe even hear from people that have implemented it on both the employer and the learner side. In terms of other support, something that MHCC has been thinking about as well is creating almost a document around what does meaningful peer work supervision when it comes to the 80 hours of placement look like in industry, because there are so many different contexts. A lot of students sometimes are being supervised by non-peer workers, so then the quality or the kind of that ability to remain within the peer work scope can be really variable. So I guess to say watch this space, we're looking at providing a few more resources to be able to kind of benchmark and provide some practice examples of what that can look like to best support organisations to engage.
Thank you. And that probably takes us to a very appropriate question maybe for Jess. There is a shortage of senior peer workers who can provide meaningful supervision to peer work trainees. How do we ensure that people get the supervision they need? And maybe that's specific to the public peer workers, if I can call them that, the peer workers who work in the New South Wales public health system.
A really great question. I guess acknowledging it's a developing area. So in New South Wales Health, we have over 50 senior peer workers and peer work professional leads working across the state, and that number has more than doubled in the last 2 years, which is great. But when we are looking at planning for traineeships, I think it's really important that we're matching students with an appropriately trained and experienced peer worker, that might be someone that's in a leadership role, whether that's as a senior peer worker, a peer work professional lead, or it might be someone within the organisation who maybe doesn't have that job title but has been in the workforce and has that advanced skill set, and would be appropriate to provide that support. And I think it's going to be a real conversation within organisations around how we identify those people, who they are, what training and support they might need to be able to do this effectively and well. But also as an organisation, what's the culture that we need to create to ensure that people are coming into a space that's safe, that's well supported, and that's well thought through. And I think this is where really looking to some additional resources and advice from MHCC, from all of the people in this space to be able to support you to do it well. Is really important, but certainly acknowledging leadership is key.
Thank you. And maybe one final question, and I'm going to squeeze in. I know time is up. There's a question from James here that says, are you looking at Certificate 4 of Mental Health Peer Work as minimum for other lived experience roles, e.g. in Victoria? And I know this does happen in New South Wales because I developed the national framework for a CMO, and we did have consumer consultants, lived experience educators, LE project officers, LE researchers, and other designated roles. So I guess the question is, I think you've answered this, Michelle, by saying that the Certificate for Mental Health Peer Work is kind of the baseline from which all these other areas can grow. But any further comments you wish to make?
Yeah, I think I did see in the chat as well that someone had made a really valuable comment around the baseline often does sort of centre around that kind of direct consumer or carer work. MHCC's qualification, while that does feature quite a bit because it is typical of a lot of peer worker roles, particularly upon entry, it doesn't just revolve around that. So what I would say is that the Cert 4 does still speak to some of these other skills, and similar to what Jess was saying around the scope and the breadth of peer work. But what I would say, just like any other qualification, again, is that it's probably something for us as a sector to consider in terms of what are other kind of additional skills, knowledge, entry level opportunities and pathways that don't exclude, but actually really represent what is needed in peer work that we can be considering. We've got some thoughts on how that can be done. But yes, I guess I just want to recognise that it is really diverse, and I think there are opportunities beyond the Cert 4 to continue to develop in that space.
Thank you so much, Michelle. Colleagues on the line, please join me as we conclude today's briefing to thank Jessica, Susan, Leon and Michelle. I think the questions that haven't been answered are really important for us to understand what the sector is seeking information on. So this isn't the end of the journey. We will make sure that we answer the questions in answered, and we'll try our best to answer the questions we weren't able to get to today. The information, as I said, today will be valuable to our audience on how traineeships can be implemented effectively within community mental health settings. When you exit the webinar, we would appreciate it if you could complete the short survey with your feedback to help us improve these member briefings and webinars. And as I said earlier, at the beginning of the presentation or the webinar, a recording and presentation slides will be shared with the attendees in the coming days. We hope this session has been useful today, and we look forward to seeing you at another MHCC event soon. Thank you, everyone, and enjoy the rest of your day. Take care.